Hello, everyone. Thank you for your time today and joining IAD as we welcome our carrier partner, Humana, to present the details and sweet spots of their Medicare Advantage plan for 2021. My name is Christy Strauss, and I'm a broker sales manager at IAD. Those of you who are new to IAD, we are a full service FMO with a national footprint. One of the many services we provide as your FMO are a cafeteria of services that you can select from. These services are really designed to help you grow your business. And so I encourage you to give us a call at 800-381-0977 or visit our website at www.iadbrokerage.com. This is our first virtual sales summit, and we will be recording it, and it will be available on our YouTube video channel in our library. It will also be available on social media pages and eventually on our website. So without further ado, let me introduce our carrier partner, Sean Holcomb of Humana. Sean, thanks so much.
Thanks so much for having me. It's a great time of year, and it's a pleasure. I usually end up in the middle of the day, at the end of the day, when I do a lot of these presentations. So it's kind of nice to be at the front end of it when I still have a voice and a little extra energy. So, um, you know, we're excited about the things that are going on at Humana. We've made a lot of investments, some in our plans, but we've also made a lot of investments in the way that we partner with our agencies like AAD and or IAD, excuse me, and yourself as agents. We're going to go through some of the highlights of the state, but in addition to, of course, being supported with IAD, I'm going to silence that line. You have a team available to you with Humana. So, we want to make sure that you guys know as partners and as agents that you are not alone out there when you're marketing these plans. There's lots of training opportunities out there. Myself and Jason Hausman work the state along with an entire suite of market point managers that are dedicated to work, of course, with our captive career agents, but they also work with our external partners like yourself to support my efforts in the state. So depending on where you're at in the state, you might have somebody like a Kevin Cooper and Tina Gabarra in the Detroit market. Jason Abro is out, further in the central northern area, Dana Lipinski in the western and southwest area. And they have a really granular look at the territory that they're in. It really comes in handy, especially when it comes to dealing with like networks, hospitals, things like that, if you have concerns around that. Okay, so, we have a few things that we're going to go through on here, but, we're going to start out with the What's New with Humana section. If you haven't certified with us, if you're either new to the industry or maybe just, maybe you're waited for the beaches to close and now you're going to go ahead and complete your certification. That's pretty common in Michigan. You're going to see that we have some new changes. Back in the day when I first started with the Medicare Advantage products, and that would have been about almost 10 years ago, Humana was absolutely a difficult company to work with by way of certification. We required not only that we completed the AHIP within 3 attempts, we also required that you did an online final exam, training tutorial and final exam, and then I had to have an 8-hour class face-to-face in order to get certified. We've come a long way since those days. We now allow 6 attempts for the AHIP, and those 6 attempts, if you get it within 6, you're good to go. There is no Humana test, so you click through our certification modules, and you just click on the attestation that says, hey, I've read it, I agree to it, I'm good to go. And then we've also included all of our products that require any type of certification in one certification. So you can certify for MA, PDP, and HMO all in one. Lastly, especially for these newer agents coming in or maybe new to Humana, it's a dual certification. So while you're certifying for 2021, you're also going to be capturing 2020 so that you can continue to get that jump start on your AEP selling season and sell throughout the remainder of the year. It's extremely accessible and easy to get to. We've now put it right on our Humana landing page, and it's the first thing that you'll see. It says get certified. You click on it and it directs you right through the certification. We've also launched our first look document, our recommendation, my personal recommendation is that you bookmark it. If you're not extremely familiar with Humana, or if you work multiple states outside of Michigan, this is a really great resource for you. It gives you a complete introduction into each part of the markets that it goes through. And by market, I don't necessarily mean just the state. I am talking about the state, but drilled down into specific areas of the state. So, I think of when I think of Michigan, you have the Detroit market, and then you have Northern Michigan and Grand Rapids, and it gives you that complete introduction and in-depth look at all of those plans. And then you get the details and the things that really make us shine in that particular area, whether it's a network relationship or a specific feature in the plans that we're offering. So it's a good idea to bookmark it. Some people like to download it and save it, whatever works for you, but it is an interactive document. We also have expanded our DSNP footprint. We've done this across the entire country. We've increased our DSNP counties by more than 20%. We now have a total of 89 DSNP offerings across the nation. 73 of them are HMO DSNPs, and 16, actually I think 17 now, are local PPO DSNPs. And that includes here in the state of Michigan. And I'm gonna go through that a little bit for you. So you'll see the HMO DSNP where we have that, and the local PPO DSNP where we have that. And working with DSNPs, dual eligibles, right? So those are folks who are both Medicare and Medicaid. We recognize that there are limitations when it comes to enrollment. And that means that you have potentially, folks who may not have easy access to the internet and Wi-Fi. It could be that their only entry point into that technology is through a phone that they've been given, and that can make it difficult to work virtually. And using the online tools and stuff that are offered, oftentimes by partners or Humana, specifically our enrollment hub. So we created an abbreviated new DSNP paper application, which, will allow you to fill out only the necessary information, and then you can actually fax it to a DSNP fax line that is, committed or designed specifically for that DSNP paper application. You can also upload it. We offer an upload option for all of our paper applications, so that is an option as well. We introduced our healthy food cards. This one's kind of exciting. We introduced our healthy food cards to our dual eligible plans starting 1/1, right? So all of our January 1 plans. And the thing is that, we recognized and were concerned that we were hearing concerns around food insecurity with some of our membership. So instead of waiting for 10/1, anybody that is currently on one of our dual eligible plans received a food card, and it began effective 9/1. The food card in the state of Michigan is a $25 benefit per month. It is use it or lose it, but they can take it to any one of our retailers, participating retailers, and those include stores like, Walmart, CVS, Food, General Dollar, those type of stores, Kroger. So we have an array of participating providers, and we've offered this on all of our dual eligible plans across the entire country in different levels and different amounts. Lastly, this is probably one that really helps us to stand out when it comes to our plans. We have the new Humana copay waiver. When you think about how we responded to the COVID-19 pandemic early on, we sent out the masks to all of our membership, and hopefully as agents, you received our green Humana cloth masks. But we also were the first to step up and waive copays, coinsurance, and deductibles for our COVID affected members. We actually have extended this now so that it's no longer COVID specific. We have waived virtual copays for PCP, urgent care, and behavioral health for all of our MA and MAPD plans for the entire 2021 plan year. So, keeping in mind that, there's a significant portion of beneficiaries out there that are still not wanting to leave their home. I think about my grandparents. They're 90 years old. They're not leaving their home. And this matters if something comes up. My grandfather's a diabetic. I think about that scenario right there, and they now have access to be able to access their doctor. If there's an urgent care situation that they need to get to, they have access to do this virtually. So This is just another great way that we are investing in our plans and our memberships. So now let's look at the plan overviews for Michigan. Uh, I, you know, I wasn't sure where everybody would be located in this presentation, so I'm not sure where all the agents are. So I wanted to cover key highlights, like all of the key PPO plans that have a broad reach across our entire state. And then you would want to go back to our first look document to kind of drill down to one specific plan. But the three plans I'm mentioning are our top sellers, and then I'll move into DSNP. So the first one here is the HumanaChoice Passive PPO. This is we call this the 001 plan because that's we're very fond of our last three digits. That's how we refer to our plans. And this plan is our low option passive PPO. The passivity, if you're not familiar with it, means that the benefits pay the same when they're in or out of network. We were first to introduce this concept back in 2019, and it's taken off like gangbusters. It really does negate any concerns around network access, and that matters not only in the Metro Detroit area, but it does matter especially when you get out to the central northern corridors of Michigan and along the more rural areas in western and eastern Michigan, and all the way up into the UP. And the benefits pay the same. When you look at the summary of benefits, you'll see the benefits line up in and out of network. They're identical. And as long as a member sees a doctor anywhere in the US that participates with Medicare and they're willing to send us a bill, they don't have to worry about any type of balance billing or exposure. So, it really does create a lot of freedom, not just within the state and their network access, but across the entire country. The plan has a $19 premium, and that premium is 100% weighted to the PDP portion of the plan. So because that's weighted to the prescription drug plan premium, those folks who have LIS, that low income subsidy, or that extra help from the government in paying for their prescription drugs, would end up potentially with a zero premium passive PPO plan. I can tell you the PCP and the specialist copays are here, but guess what? They're waived, right? So, if they go see the in-network doctor, if they see a feet on the ground doctor face to face, you would be exposed at $10 and $45 as a member. Another differentiator for us is the inpatient hospital stay and the way that we administer that or handle that. It's $390 per day for days 1 through 5. However, that $390 is an all-inclusive, right? There are no additional costs, exposures, anything like that a member would expect. So, oftentimes if you see a beneficiary, if you have a family member that's been in the hospital, sometimes there's a situation where you see a specialist physician who pops their head in for 10, 15 minutes, and you'll see a $2,000 charge on your bill. And sometimes there are different types of tests. So you have to kind of pay attention as a member, to how that benefit is administered. So that $390 for days 1 through 5 is all inclusive and the most that you will pay while you are in the hospital. Maximum out of pocket is $5,900. We have reduced the prescription drug deductible on this plan. We've cut it in half. It's now $75 for tiers 3 through 5. So tiers 1 and 2 would have no deductible exposure. And we've added some key extra benefits to this. So we have added dental and vision, and it already had hearing on it as well as fitness. So, if you think about positioning on this plan, you want to think about those folks who are LIS eligible. They're kind of looking for that freedom of network. Maybe they want a nice low price point for a plan that will give them, the ability to move, maybe snowbirds who want an affordable price point. And they still want some of those key extra benefits. The plan is available statewide with the exception of Wayne and Macomb County. All right, so the next plan that we have here to talk about is our Humana Honors Plan. This is a nod to our veterans. It was originally designed for them, and while it's designed for them, it is not exclusive to them, meaning anybody can enroll in the plan. It too is a passive PPO. It has a $40 Part B give back that's administered through Social Security. And that means that Social Security can take a minute for it to catch up. So once it's out there and you've enrolled somebody, it can take them up to 90 days to process that Part B give back. That's a delay because it's Social Security, and if you just prep your client, let them know that it'll start them off on the right foot. They do a great job of true upping and balancing it out and giving them that full 120 credit after that 90 days. The plan does include dental, vision, and hearing. Silver sneakers is included in this, as it is on all of our plans. We have increased the OTC benefit on this plan to $45 a quarter. If you've not seen that catalog, $45 a quarter it can matter to a lot of folks, and it can give them access to, the really great things, anything from a Fitbit up to, the Advil or the, back patches or blood pressure cuffs. I mean, all of that is out there. The other thing to take into consideration is that, when you do run into those individuals who have no prescription drug coverage because, perhaps they slid into that category of, hey, I don't take prescription drugs, I don't need them, I'm not going to pay for something I don't need. We all know those folks are out there. This is a good fit for them. So you certainly don't need to shy away from it at all. The plan has a $10 PCP, $45 for a specialist, $295 for days 1 through 7 for that inpatient hospital stay. And again, it is an MA only plan, so there is no prescription drug coverage on it. It's available statewide, every county. Next up, we have the Value Plus plan. This plan originally, when we originally launched this a couple years, was really meant to answer the need for a DSNP plan in areas where we did not have an actual DSNP. So we referred to it amongst us professionals, and certainly not with Medicare beneficiaries, but we refer to it as a DSNP lookalike. That is maybe no longer the case. We found that what we had was in addition to those folks who were dual eligible, we now have offered actual dual eligible plans that have replaced the need for this. But we had such a significant portion of members that were enrolled that were not dual eligibles, and we kind of had to figure out what was going on there. So, what we found was that that's my dog, guys. Sorry, he's groaning. What we found was that, if you had folks that were LIS eligible, this has a really great price point on it. It's $15.60. And it's a kind of a Medicare lookalike when it comes to copays, coinsurance, and deductibles. So if you have somebody who's, LIS eligible because it's 100% weighted to the PDP portion of the premium, or they're healthy and they're risk takers, they understand how copays, coinsurance, and deductibles work, but they really want those key extra benefits, this is really a great plan. The other buyer for this might also be somebody that you would run into, and I'm sure as agents you're encountering this more and more, are those folks that are on spend downs, right? Because we went through the rollback of the Medicaid expansion. And when we went through that, we started that a year and a half ago. Those folks that fell between that 100 and 138% of the federal poverty level, there was a significant portion of those folks that have been moved over into the spend down arena. And so, those folks, they need an option that will work for them. So when you have a Medicare lookalike when it comes to copays, coinsurance, and deductibles, that actually can partner well. And then consider all of these key extra benefits that are in here, which is really what attracts them to it. So think about the dental. The dental is $1,000, and like all of our dental plans, regardless of how much it is a first dollar benefit, meaning that we don't limit them to a quarterly amount. There's no, necessary things that have to be done. It's $1,000 day one, and it has coverage not only for your preventive services and your cleanings, fillings, crowns, but it has major services like extractions, I mentioned crowns, and dentures. So, that's the beautiful thing about the plan, and it's DentalMax network. So that means that it's a really broad network, actually as broad as it gets here in the state of Michigan. The vision on this is IMED. That's the network that we use. IMED is a very large national network of providers, and it includes not only your big box stores, but you have a lot of the mom and pops, optometrists, and ophthalmologists. So it's a really wide option, or wide network option. The plan itself has an annual exam included, $200 credit every year for eyeglasses or contact lenses. And because this is a PPO plan, there is some out-of-network coverage there, but there are some restrictions. The hearing on this is administered through True Hearing. True Hearing is a network, and they provide a zero cost for the annual exam, zero cost for fittings, but it also includes zero cost for the True Hearing advanced level hearing aids. Plus, we give them 48 batteries. So those hearing aids, they're one per ear per year, and these aren't knockoff low end hearing aids. These hearing aids are valued at approximately $3,000 per hearing aid, and we're providing them at no cost to that member. This alone will more than justify the expense that might be incurred with some of the copays and deductibles for a member. So this is, if you hear somebody talk about hearing aids, this might be their option, their plan that they're looking for. OTC, over-the-counter allowance on this is $100 per calendar quarter. It is a use it or lose it, and we have a really great catalog that's included with all of our kits. And then transportation on this is another really big differentiator. So when you think about where this is located, right, we don't offer this in the Metro Detroit area, but we offer it in all of the surrounding areas and in central and northern Michigan. So when you think about that, that means there's a lot of rural area exposure. So one of the things that we heard pretty consistently when it came to our transportation benefit, which was already, in my opinion, kind of the front runner and a real differentiator, is that it used to be unlimited trips for a 25-mile one-way radius. So 25 miles out and 25 miles back home. And when you got out to the rural areas, 25 miles would get you a long way, but it might not get you all the way to where a member wanted to go. So we tried to look at the numbers and figure it out. And what we did was we put in limitations on the number of trips. That limitation is now 60 one-way trips, but we have doubled the radius. So there is now a 50-mile radius. That's 50 miles out and 50 miles back. And if you think about that, the 60 trips might be a limitation, but what we found is that something, I think it's like 92% of our transportation utilization fell well underneath the 60 trips. So just know that you have 60 one-way trips that'll take you out 50 miles. That's a long way, folks, and that can be a game changer for a lot of beneficiaries. So this is the Value Plus plan. It is a passive PPO, and it is the third option that we have available for our key plans. All right, so now I'm going to jump into DSNP. I'm going to take a little sip of my coffee. Okay, so DSNP for 2021, we have some really great changes, some pretty exciting things. If you happen to work in the Wayne, Oklahoma-Macomb, Washtenaw, Genesee, Livingston area, and Ingham County, this is your DSNP. It is our HMO DSNP, the Gold Plus HMO DSNP. And again, you know it by those three little digits at the end there, the 005. Now, one of the great things about our HMO plans, and we have several of them, like in Detroit, we have a zero premium HMO plan, and in Ingham County, we have a zero premium HMO plan. That plan stacks up beautifully when against any other zero premium PPO network plan here in the state of Michigan, because it's a large network and it's open access. So that means that you can work freely within the framework of our HMO network. And, when you're a dual eligible, that's important because it gives you the freedom to kind of figure out and decide where you want to go and receive your doctoring and your services. So this plan, if being a dual eligible plan, copays, coinsurance, and deductibles become a moot point, and you really look at what's driving the buying behavior, and that's these key extra benefits. And looking at this plan, anybody who is, FBDE, QMB Plus, or Slim B Plus, if you can see that in that tiny writing over here, anywhere in the country for Humana would qualify them for our dual eligible plan. Those 4 levels of Medicaid are the cost share protected levels of Medicaid. So dental is $2,000. And remember, this is a first dollar benefit without a limitation. So you don't have to worry about, a quarterly benefit. I know that there are carriers out there that might have a $2,000 benefit, but they have a $500 quarterly limit. So if you wanted to get a set of dentures or an upper denture that would cost you $1,000, well, your plan would pay 500, but who's going to pay the other 500? That would be the member. So you never really get to a full 2,000 when you have a plan like that. This is something that is different with Humana. I mentioned the healthy food card. This is now included on our DSNP plans. The vision has been increased. It's now the annual exam and a $300 credit every year for a complete set of eyeglasses or contact lenses. OTC on this plan is $240. I think about OTC and you see some big numbers out there. I know this plan actually used to have a $300 on there. What we found is that people weren't actually even coming close to hitting that $300 per quarter. So, why build a cost into something that nobody's using? And when I say nobody, I mean nobody hit that 300. So, that 240, it's still well within the realm of giving them what they need, and it includes things like we have different levels of Fitbits that range from $75 up to $240, depending on how new and how techie it is. And then you also have things like bladder control, and I mentioned blood pressure cuffs and shower chairs. All that stuff is out there in our OTC catalog. Transportation on this is zero copayment for 100 one-way trips per year, 50 miles out and 50 miles back. So that's a pretty long way to go to be able to receive your services. If you're in the Metro Detroit area, it's going to get you pretty much, pretty close to anywhere you want to go across the Metro Tri-County area there. The plan itself, I mentioned, is available in Wayne, Oakland, Macomb, Washtenaw, Genesee, Livingston, and Ingham. If you happen to be an agent that works in the Lansing area, this is your Ingham County plan, and this is your Eaton County plan. This plan right here was by far our number one growth plan across the entire state, even though it only went up to like mid-Michigan and down and kind of surrounded the Metro Detroit area. This is our HumanaChoice PPO DSNP. This was a brand new concept that we introduced last year. And in doing so, we really wanted to speak to the needs of members and beneficiaries. We wanted to talk about, give them access to things that they wouldn't normally have. And we were already doing that by including things like the dental at $1,000 and now adding the $25 healthy food card. By, including vision, it used to be $200, now it's $300. By including, hearing aids at no cost, and the OTC, which on this plan is $150, or the transportation. All of those key extra benefits were really designed to help them get access. There's no smoke and mirrors built into those benefits, right? They can get immediate access to them. And we wanted to change the quality of life, which meant we needed to give them access to services and providers that they might not otherwise have. So we introduced the PPO DSNP, and if you think about, as someone who might have a situation where, I know I received a call early in the year, last year, with from an agent who had a member that had just received a really unfortunate diagnosis. And they wanted to see, what would happen as a dual eligible if they went out of state and, out of network. And at that time, we really didn't have an option. Neither did any other carrier. They would have had to have purchased a non-DSNP plan. And, that window had already closed. They didn't have an SEP. Well, when we introduced this, it was literally 45 days later, we rolled out this plan. And that gave them access to the Cleveland Clinic, which is where they wanted to go. Cleveland Clinic happens to be in network for us. And because it was in network, there were no additional co-pays, co-insurance, or deductibles, any additional exposure for that DSNP member. They managed their own transportation there, but they were actually able to get services where they didn't have access before. So that's a game changer. It changes the quality of life for an individual, and it puts choice and options in their hands. And so this PPO DSNP, we're excited to launch it now, not only in the bottom southern half of Michigan. We have expanded this all the way up to the top of the mitten. So as long as you stay under the bridge, this is your DSNP plan, with the exception of the areas where we have an HMO DSNP. So, that would be every county with the exception of the ones listed here, which are Wayne, Oakland, Macomb, Washtenaw, Genesee, Livingston, Ingham, and Oscoda. All right. So, I know I have about another 15 minutes or so. I thought, it was important not only to talk about the investments that we've made in the plans that we have, but also to talk about the investments that we've made in your business and how you do business. COVID put us in a completely different environment. And, we've had a lot of agents that have adapted and some are just now starting to adapt. And so, we wanted to kind of make those investments so that you could be that hybrid agent if that's what you wanted. If you want to be feet on the ground, face to face, fantastic. We've given you great tools to do that. But if you are an agent that wants to work virtually and save yourself some time and energy, less time in the car, we've given you those tools. By using the online environment and the virtual sales environment and those tools, you can increase your efficiency. It makes things easier, faster, and it prevents a lot of mistakes, right? When you're filling out paper applications, things happen. You don't always not all agents write legibly, and that can cause problems on a paper application, or sometimes there are just things that happen. When you work with the online tools that we have, we prevent 99% of those because we have built-in programs that will stop you from making those mistakes. And we're always improving them, and we make sure that you have access to them through our Humana Vantage portal. So the first investment that we've made is in the RX Calculator. RX Calculator allows you to import, using blue button technology, import your client's prescription drug list, and when they pull it in, our system will analyze it. It'll make a plan recommendation. You're still the expert, so you need to help guide them, HMO versus PPO, and what doctor is in which plans, things like that. But that's almost a non-issue now. But we'll make plan recommendations based on the savings that they have. However, one of the more important tools that this has is that it will allow you to save and print, or save and email your client's projected costs for their prescription drugs, and that you can put that in their hands. So, that's a really great tool because it helps them be able to manage their year and their costs and exposures, and you're solving a problem for them. The other investment we've made is into the Find a Doctor tool. This used to be called Physician Finder. Physician Finder used to be a little clunky. It was a little antiquated. Wasn't super streamlined. So we modernized the look, and we've done a few things like not just making it more intuitive, but we've also added our Care Highlight program. Care Highlight allows us to, look at a physician's performance using objective criteria that is certified, and it allows us to rate their performance on a couple different levels. The first level is on their effectiveness of care. So are their recommendations and treatment plans providing outcomes that are favorable for the member? That is one of the ratings, and you'll see the ratings are in hearts. So, you see stars on a lot of apps, right? We use hearts. And so you'll see up to 4 stars. And, that's a really good conversation to have with your client. The other second one that we rate on is the cost efficiency. And cost efficiency isn't about, hey, are they cost efficient for Humana? It's about whether or not they're cost efficient for the client. Are they introducing them to the resources that they have available, like the Humana pharmacy? Are they making recommendations that, they have their lab work done offsite? Where it is less expensive than if they go to a hospital, things like that, right? It costs the member less money. And those 2 different items are conversation starters when either you're looking up somebody's physician and you see that maybe there's a less than favorable option, and you can have that conversation and help guide them into different choices. Makes you the expert, gives you those tools. Enrollment Hub allows you to enroll electronically. And we use this not just in the face-to-face environment where you can capture a digital signature, but this can be used in the virtual environment. We have telephonic signature available on it, which takes about 8 minutes. So you can sit there and do a Zoom or whatever system that you're using, or even if you're just talking over the phone, you can enroll them online, click telephonic signature, and it will do a 3-way call, walk you through a 3-way call. They listen to a recording for 8 minutes with you on the line, and then you are actually able to prompt them if needed to say, okay, Mr. So-and-so, this is where you would say yes or no if you heard the information or agree to it. So, and then we capture that signature, give you a number, you plug that number into the application and submit it, and you're done. So it really is a great tool for helping you not only in that face-to-face environment, but however you're working, whether it's in a Zoom environment or over the phone. We've added a digital scope of appointments, so you can not only capture it with your fingertip and the signature if you're face-to-face, but you can email that scope of appointment, or we have telephonic scope of appointment. It pre-fills all that information. So when you do the SOA, you are able to take that information, you start the application, and it moves that data right over into the application. And then all the forms, everything that you need to set your client up for success is already built right into Enrollment Hub. You can bypass them if you want, or you can enroll them at the time. So I always think about RX Calculator is there, but the Humana Pharmacy sign-up sheet is there, the HIPAA release, if they want to have their spouse have access to their information and be able to call on their behalf, that's embedded in there. Of course, your summary of benefits, all of that stuff is right there at your fingertips. We also have our digital marketing materials. This allows you to send a complete compliant sales kit digitally or electronically to your client. You can choose up to 3 plans, and they can actually peruse the sales kit themselves. And you can either have done the sales presentation ahead of time, or you can do it after. And then it gives them the option to either self-enroll or contact you, and you can do the enrollment for them. So the nice thing about this is that it's putting the materials in their hands, and it also will go be sent with a copy of our compliance sales video presentation that kind of talks through all of the have-tos for our compliance sales presentations, all the things CMS requires, covering the difference between Medicare and Medicare Advantage and the different type of PPO, HMO networks, those type of things. We now have it available for DSNP plans as well as in Spanish language. All right, so let's talk about some of the fun stuff. Humana has introduced a new member care assessment. We use the Ascend platform. It's called Revel, powered by Ascend. And this means that we're asking you to do a brief, maybe 7 to 10 minute survey after you've captured their signature. And you can access that online. It is not available on paper. But regardless of how you capture the enrollment, paper, telephonic, whatever, you can then enter into the Revel platform with your user ID that you receive by doing a brief tutorial on the Market Point University. And when you do that, and you do it within 48 hours of the signature, you will receive a $50 bonus. So it's already out there being utilized in some form by other carriers. We've introduced this nationwide, so it's an extra $50 bump for spending an extra 5 to 10 minutes. It does not require a member signature, but it gives us the information different than a health risk assessment. It will give us the information that will allow us to connect that member to certain services that are embedded in our plans, like transportation or dental, vision, or even some of the core benefits that are in our plans. So it helps us to connect them to those services, because we know that when we connect them, it creates persistency not only for us, but for you as well. So definitely, it launches on the 22nd of September. You'll be able to go out and do the tutorial on Market Point University, and then you will be able to access the system for 10/1 effective dates. All right, so quickly, we're going to go through some of the tools with the Humana Vantage. We've made a lot of investments there, but the Humana Vantage landing page looks just like this when you go in. If you're going in through a laptop or a desktop, it does vary depending on which interface you're using. So, just kind of get comfortable with the lay of the land. If you're looking to do Enrollment Hub, it's right here in the middle section, but you have the My Humana Business Center over here on the right. Service inquiries is something that's going to be super important for you. And then, of course, you have the Get Certified, Recertify button that's right there. It's available across platforms, whether it's iOS, Android, or Windows-based, and whether it's a phone, a tablet, a laptop, doesn't matter. The interface might look a little bit different, but you have access to everything that you need. You can certainly run reports. So if you wanted to work strategically to hit a certain area where you want to move somebody from a group of people from one plan to another, if you wanted to send out birthday notifications once a month, if you wanted to pull everybody that was on the Value Plus plan in the northern quarter that you wrote last year, you could do that and then go back out there and roll them into our new local PPO DSNP. So this gives you access to the reporting. It also gives you access all the way down to the member level detail, so you can get their plan number, their the contract and plan design number, as well as their Humana ID. It gives you address, phone number, everything that you've imported is accessible right here. And then you have the ability to, within the Humana landing page, you have the ability to upload paper applications. So I mentioned that when you're doing your DSNP paper applications, you can upload your paper applications, and you have to do them one at a time, but we'll give you an email confirmation, which is a really great thing to have. When you're submitting paper applications, right? To get that confirmation. Everybody always waits around for that fax number, and the fax number is always jammed, right? So the next one that we put out there, and this one's very, very cool. This is our DSNP verification tool. It's out there on the Humana landing page, and it allows you to be able to go out and you put the Medicare ID number, the Medicaid ID number, date of birth, and the gender of the member, and then we will tell you what level of Medicaid they have, whether they're QMB, QMB plus, Slim B, Slim B plus, or FBDE. And that's important when you're working with the dual eligible community, because you'll find a lot of people will tell you they have Medicaid when really what they mean is they have a spend down or they have LIS, and they don't always understand. This allows you to be able to do that work so that you can pivot appropriately and have the materials you need when you go to visit your client. It's out there 24/7 for you. And if you haven't used it yet, or if you haven't seen it, please go out there. I'm not sure why they put DESNP. I think that's what happens with operations from a 10,000 foot perspective, but it's out there and it's available for you. You can do service inquiries. So after the first of the year, you have, I always have a lot of calls about, hey, I wrote this incorrectly on the application, or I put the wrong plan number down, or I spelled the name wrong. You can actually go out there and correct that for yourself at the service inquiries tab and pull the information right from your site, fill out that form, and we'll fix it without further ado. It usually takes 24 to 48 hours for the basic simple stuff. It can take up to a week if it's something that's really complicated or if we need follow-up information. We also this year are introducing the transparency tool for our interactions, so that you will know when we're contacting your client and when your client is contacting us. So you would go to your member level information, go down to interactions, and you would see outbound calls from Humana, why we're calling, and any inbound communication from them. This kind of heads off that conversation about, hey, why is Humana calling my client? People think that we make outbound sales calls, and we don't. So, there are other companies that might do that. So we wanted to create transparency so you would know we have that true partnership with you. This isn't just our client, right? Humana's. This is our client, you, the agent, and Humana together. Lastly, I'm going to talk about Reach Rewards. I know I've got about 2 minutes left, and I think I can get through this. So Reach Rewards rewards agents for every interaction that you do. The points range from 10 to 100 points per action. And those actions are things like sales, Medicare Advantage, if you sell a new Medicare Advantage plan, new to Humana, or a prescription drug plan, or if you add dental and vision to one of our plans, or maybe you attend one of our in-field, when we're back out in the field, meetings, or our virtual training events, or, the marketing resource center. Maybe you download materials and, for mailing. We give you points for all those things that you're already doing, and you can those points turn into rewards. So this is kind of an outline of what those points might look like, right? If you write a brand new to Humana Medicare Advantage plan, MetSup or MA, that's 100 points. If you add dental and vision, that's 50 points per dental and vision. So now you have 200 points for that enrollment. If you enroll them using Enrollment Hub, now there's another 30 points. That's 230 points. And the points vary depending on the action. but they add up, and the more points you have, the more rewards you get. So you have like AHIP reimbursement that's out there, Kaplan Educational Services, or even our ambassador event if you hit that top level. The levels are listed here, and you can see we do things like add marketing resource center credits, monies that you can actually use to send out mailers or buy trinkets and tchotchkes for your clients. And it goes all the way up to that top level where we have top performing agents that we would bring in for a mind share event with peers from across the country. The points reset every year on July 1st, so it runs June 1 through June 30th, and you can use those points through the end of that year. This is the most important piece. It is an opt-in. You have to go to HumanaReachRewards.com to get the rewards, and do it right away. Don't miss out on sales, right? So we launched this in July. It's effective right now, and you can go out there, and if you're selling business with Humana, or you're going to be selling business even before AEP, you want to make sure you're getting your rewards. So, go to Humana Reach Rewards. It's a basic email. It takes you about 3 to 5 minutes, and you would be all set and ready to go. So I want to thank you for the time, and thank you for listening and partnering with Humana. Thank you, IAD, for the opportunity to talk about the great things that we're doing here. Hopefully what you've seen is that we are making investments in humans, whether that is human beings that are, our clients, our Medicare beneficiaries, or our partners. We're trying to make things easier in providing you ways to do business, whether that's face to face, in person, face to face over Zoom or telephonically, however you need to work. We're making that environment easier for you. If you have any questions about anything that I've learned, of course, you can go to IAD. You can certainly contact myself or my partner, Jason Hausman, but there's additional training and resources at Market Point University. And thank you again for your time. I'm going to hand it back now to Christy.
Sean, as always, thank you for a great presentation. It looks like you don't have any questions, and that's a good thing. But appreciate you all for joining in today and learning about the Humana plans for 2021. Have a great day.
Thank you so much, everybody. Have a great day. Bye-bye.
Bye.